If you've had ACL surgery and the front thigh muscle looks like it belongs to a 5-year-old, this video is exactly for you because I'm going to tell you exactly what to do about it. First things first, it's important to note that losing the muscle mass on your leg post ACL surgery is completely normal. There are various things in which we can do to prevent it and to slow it down, but you won't stop it entirely. But a good physio and a good rehab program helps to kind of slow the rate of loss right down. Just checking the mic again. Because it's so echoey in here, trust me, if that wasn't working, you would all not be very happy. So it's totally normal part of ACL surgery is losing muscle mass, okay? But we must start straight away at getting it back. So there are 3 reasons why you are going to struggle with putting that muscle mass back on, okay? Reason number 1 is, and there's 2 reasons in here actually, your plan. So the exercise program that you're doing is not good enough to enable you to actually build muscle. So rehab is all about progressive overload. That's how we build muscle, right? You've seen bodybuilders train in a gym, I'm sure, for months and months and months, weeks and weeks and weeks, just to increase their bicep size by like a centimetre. They are working really hard at that. Gaining muscle isn't an easy task. You know, it's not for the weak-hearted. Now, the program needs to be based on progressive overload. And I'm actually a clinical business mentor. And I get so many of my clinicians that come to me that are therapists and clinic owners to actually do a strength and conditioning course. Because when you look at it, once we get past the womb stages and managing swelling, managing ROM, which should be easy for physios and clinicians, the rest of it is actually about rebuilding. It's about gaining muscle. It's about being able to jump higher. It's about being able to sprint. And what fundamentals teach us that? Well, strength and conditioning. So a good program, a good plan is what you need based on progressive overload, not week by week, not changing exercises weekly, 2 weekly, monthly. It doesn't work like that. If you need to build muscle, you need to do the same exercise 3 to 4 times a week, 8 weeks minimum, I would say, for the average person to actually notice an increase in strength gains and also overall thigh circumference, etc. The second problem with the plan and the programming is you. Yep, you heard me right. It's you, because so many people don't actually train to failure. And this is a problem for people that I think shouldn't have had ACL surgery, which I've covered in a previous video. If you haven't watched that one, go and watch who I think shouldn't have ACL surgery. Are the people that are just not prepared to put the work in. You can't go to the gym and not get sweaty, or you can't work out from home forever. You need weights and you need to work out really hard till your legs feel like jelly and your head is literally going to burst. Probably not to that extreme, but you get my point. We're not going out for a walk in the park. We're going to the gym to actually train. Are you training as hard as you should be? I don't know. You tell me. Are you actually doing that? Because some people that I come across, they're not. It's not my program. When somebody's not gaining muscle mass or they're like, my strength numbers aren't going up, I've done this with over 3,000 people. That isn't my program that's doing that. This is a you problem. So are you actually training hard enough? Do you have a plan that's progressive, overloaded, based obviously, or do you know what? Why don't I just start that again? Is your plan based on progressive overload? And are you training hard enough? There we go, got it all out in one. How amazing am I? Second thing, are you actually eating enough calories and enough protein? Because if you aren't eating enough calories overall, you will go into your workouts totally underfueled and you won't be able to actually give 100% effort because you don't have the energy to do that. But also with protein, those are the building blocks of our muscles, okay? The majority of the people in the world do not eat enough protein. People undervalue the amount of protein that they eat massively. I'm not saying you need to drink protein shakes and all that stuff, but what I am saying is that you do need to increase your protein intake. I actually have in my ACL nutrition guide loads and loads of different recipes. Check that out if you are struggling with your nutrition or if you think you're underfueling. But the key thing is that you're eating before your workout, so pre-workout meal. I always discuss this with my patients. And then you'll have a post-workout meal. So pre-workout, you're going for kind of faster acting carbohydrates. Post-workout, you're going for carbohydrates to refuel your glycogen stores, and then also protein dense, so a higher protein content in that meal to help you actually repair your muscles. Third thing, and the final thing, are you actually recovering? If you're stressed, if you're not sleeping well, you will not be recovering as well as you should be. You will ache, you will have less energy overall, you'll be craving terrible, bad foods that's ultra processed and just easy, quick go bites. That is not going to help you. If you cannot recover well, you won't be able to build muscle. And like I said, building muscle is really difficult. I mentioned that at the start of the video. You've got to have all of the stepping stones in place. Stress is going to inhibit your ability to actually rest and recover. And there's a really cool study on this as well. I'm not going to cite it because I'm not 100% sure, but when you are stressed, muscle gains and protein synthesis actually goes down. I'll maybe try to find that and link it in the description. But stress will inhibit basically your rate of recovery. Alcohol as well, that's a key one. Now, I'm not here to be like the no fun police. I'm telling you that you need to work harder. I'm telling you that you probably need to eat more, especially eat more protein. And now I'm telling you need to recover better. The likelihood is you're probably doing all of these things, little bits of it anyway, naturally, because you're, a sporty type of person. But when you're building muscle post ACL surgery, it's 10 times harder because the load that you're using is often lower because we don't want to overload the knee too soon. So when you try to add all of these things, you really do need everything to be pretty much perfect or as close to perfect, because if one plate is not spinning at the right time, it all comes crashing down, I'm afraid. If you've watched this and thought, you know what, my gym plan is changing every week, there's not enough progressive overload, I don't even have enough time to build strength gains, or my plan isn't challenging me, or my plan is just random workouts I see on Instagram or TikTok, I hope that is not you if you're watching this on my channel and you're a subscriber especially, because you know around here that is not how to progress in your ACL rehab. But if you're watching that and thinking, do you know what, I need a plan, I need a decent plan, check out my complete ACL recovery guide. It was actually a year old, not yesterday, the day before, so it's been out for 12 months, which is really cool, and a patient actually got me a card to say happy birthday to the complete ACL recovery guide. But you can check that out. It's £89. Might just be the solution that you're looking for. If your nutrition is off, check out the ACL recovery nutrition guide. I wrote that because so many people often just aren't eating the right things at the right time to fulfill their recovery. But if you do nothing about this and you just keep training and you aren't seeing any changes, you're not even measuring your progress, which is a whole new video for another day, but you need to measure your progress. You need to actually understand and go, do you know what, over the last 30 days, this hasn't improved, this hasn't increased, something is seriously off here. I don't want to repeat the next 30 days and get 60 days in and go, do you know what, I don't see any changes. What changes am I actually making? So my favorite term is nothing changes if nothing changes. And the first change starts with you. I hope you found this video useful. If you have, please subscribe and like, because it tells me that you guys are enjoying these videos and that I should probably keep turning up and trying my best to string my words together in a way that it comes out that you guys all understand it, because you've seen from this video and previous videos that often just isn't the case, because I don't do this all day long. I spend my day actually rehabbing knees, lots of them. So doing this is particularly difficult, believe it or not. But I hope you found this video useful, and I will catch you in the next one.